I want to begin by expressing my gratitude for your presence and for taking the time to delve into a topic that, while sensitive, deserves thoughtful attention and understanding. Today, we'll address a question that many men in their 60s, along with their partners, may have encountered. Why does ejaculation sometimes occur without the release of semen in men at this stage of life? This subject, though it may feel complicated or even a bit uncomfortable for some, is entirely natural and has well-defined medical and psychological explanations. The purpose of this discussion is not only to provide knowledge, but also to remove any stigma and offer reassurance to those affected. This conversation is particularly relevant to individuals over the age of 50, as life experience often enables us to approach these topics with greater openness and wisdom, free from unnecessary taboos. Understanding how the body changes with age as we grow older. The human body undergoes various changes, and our sexuality evolves alongside it. For men, one such shift can manifest as a reduction or even complete absence of semen during ejaculation. This occurrence is not inherently a cause for concern. Instead, it is often a natural aspect of the aging process or the result of certain underlying health conditions. Understanding these changes can help us approach them with acceptance and confidence. Exploring the causes of ejaculation without semen. Why one retrograde ejaculation, a primary cause of ejaculation without semen, is retrograde ejaculation. This condition occurs when semen flows backward into the bladder rather than exiting the body during orgasm. This backward flow can result from changes in the muscles around the urethra and bladder neck, which may lose strength or tone with age, allowing Sean to take an alternative path. Reassurance: retrograde ejaculation is generally harmless and does not adversely affect overall health or bodily functions. 2. The role of medications. Many older men rely on medications to manage chronic health conditions such as hypertension, diabetes, or prostate issues. Certain drugs can interfere with the muscles or nerves that control ejaculation, leading to reduced or absent semen release. If you believe that your medication might be contributing to this change, it's important to consult with your healthcare provider. Adjusting the medication or exploring alternative treatments may help mitigate these effects. Expanded discussion: prostate procedures and their after-effects. Prostate surgeries often performed to address conditions like benign prostatic hyperplasia. BPH can alter the structures involved in ejaculation. While these surgeries significantly improve urinary symptoms and overall quality of life, they may result in retrograde ejaculation. As a side effect, being informed about these potential outcomes can help set realistic expectations and reduce unnecessary concerns. Psychological aspects and coping mechanisms. In addition to physical factors, psychological influences such as anxiety or self-consciousness about these changes can play a role in how men experience intimacy. Open communication with your partner and consulting a therapist who specializes in sexual health can provide valuable support, helping to alleviate stress and foster deeper emotional connection. Actions: embracing sexuality beyond physical changes. Finally, it's crucial to redefine what sexuality means in the later stages of life. Intimacy and pleasure are not solely dependent on the mechanics of ejaculation. Emotional closeness, physical affection, and shared joy remain integral to a satisfying sexual relationship. By shifting the focus to these aspects, couples can continue to enjoy a rich and meaningful connection. Sexual health is an ongoing journey, one that can evolve and deepen with time. If you or your partner have concerns about changes like these, seeking guidance from healthcare professionals can provide clarity and support, ensuring this stage of life is as fulfilling as possible. 3. Prostate surgery treatments for an enlarged prostate. A condition frequently affecting older men, often result in retrograde ejaculation as a side effect. These surgical procedures can modify the anatomy, controlling the flow of semen, altering its path during ejaculation. While these operations provide substantial relief from urinary symptoms such as difficulty urinating, It's crucial to understand the possible impacts they may have on sexual function. Being prepared for these changes can help individuals navigate their recovery with greater ease and acceptance for hormonal changes. A natural decline in testosterone levels occurs as men age. This hormone plays an essential role in driving sexual desire and supporting sperm production. Though lower testosterone is rarely the sole reason for ejaculation without semen, it can amplify other contributing factors. Consulting an endocrinologist to evaluate hormone levels can offer insights into the broader picture. Hormone replacement therapy or other interventions may be recommended, depending on individual circumstances. Psychological factors, concerns related to performance, or unease about bodily changes often contribute to stress and anxiety, which can further influence sexual responses. Open discussions with a partner and professional guidance from a sexual health therapist can alleviate these worries, paving the way for greater confidence and improved intimacy. Additional insights and expanded perspectives, embracing the emotional side of sexuality later in life. The emphasis of sexuality often shifts from physical performance to emotional depth. Intimacy becomes more about connection, understanding, and shared affection. By focusing on these elements, couples can redefine their relationship and enrich their bond, creating a satisfying sexual experience that transcends physical limitations, celebrating orgasms. Beyond semen release, a common misconception is that Sean is integral to achieving an orgasm. However, orgasms are multifaceted experiences that involve the brain, nervous system, and entire body. Many men who experience retrograde ejaculation or reduced semen release report the ability to enjoy equally fulfilling orgasms. Recognizing this truth can remove unnecessary pressures and allow couples to explore their intimacy in a more relaxed and joyful manner, strengthening communication in relationships as partners. Age together, open and honest communication becomes an invaluable tool for navigating changes. Sexual health, sharing personal experiences, discussing fears or misconceptions, and setting realistic expectations can foster deeper trust and mutual understanding. Such conversations can also help couples discover new ways of expressing affection and sustaining intimacy, ensuring that their relationship continues to thrive despite physical changes, individual variations. It's important to recognize that these changes, while common, don't affect every man. In the same way, each person's body responds uniquely to aging, and what feels normal for one individual may differ for another when change is cause discomfort or raise concerns. Seeking advice from a healthcare professional is the best course of action. Medical experts can help identify whether the changes are a natural aspect of aging or if they might be linked to other factors that require attention, a message of encouragement and reflection. As we wrap up, I'd like to leave you with a message of encouragement. Sexuality and maturity remains a valuable and enriching part of life. Although physical changes are inevitable, the fundamental human desire to love, connect, and find joy in shared intimacy endures. Embrace this phase of life with curiosity and positivity. Approach it as an opportunity to grow and redefine intimacy, exploring what truly brings you and your partner happiness. Thank you for taking the time to engage with this discussion. Your presence reflects a commitment to learning, growing, and living fully through every stage of life. Additional thoughts on navigating aging and sexual health. Viewing aging as a shared journey for those in relationships. Navigating these changes together can deepen emotional bonds, shared understanding, and mutual support. Create a foundation where intimacy thrives. Facing these challenges as a team reinforces trust and strengthens the connection between partners. Exploring new avenues of connection. Aging can open the door to exploring new dimensions of intimacy and pleasure. This might mean discovering different ways to express love, trying alternative forms of closeness, or simply enjoying the process of learning more about each other. The journey itself can be as fulfilling as the destination. Building a supportive community, joining discussions like this one, fosters a sense of belonging and shared experience. It's a reminder that you're not alone in facing these changes, and that support is available. Engaging in open conversations about sexual health and aging contributes to breaking societal taboos and creating a more accepting, informed community. If you have any additional thoughts, questions, or topics you'd like us to cover in future discussions, don't hesitate to share them in the comments together. We can continue to learn and grow. See you next time.